Good afternoon, everyone. If everyone will grab a seat real quick.
Very proud of you.
Wow. All right, we will get started. Good afternoon, everyone. Welcome to the April meeting of the Mental Health System Board. We've noted that we have a quorum present, and as always, we're streaming on YouTube, so be aware that you don't want to be a star and be seen all over the world just yet. So just be aware of that. First duty we have is to approve the minutes from our last meeting of 3/25/26. Could I have a motion?
So moved.
Thank you. Second.
Second.
All in favor, say aye.
Aye.
Aye. Any opposed? Any abstentions? Carries. We always like to start our meetings with a mission moment, so I will turn the floor over to Dr. Alexander.
Thank you very much, Dr. Walker. So as we reflect on what we're going to see, I just want to remind everybody of some statistics. When you think about the health of our community, 80% of what influences that health happens outside of the health system. So truly, of all of our efforts in the office, in the hospital, everywhere where we provide care really only impacts 20% of somebody's health. And the whole idea behind developing the Institute for Hope was to address that 80% of things like food and housing and jobs, etc. Today, we're going to focus a little bit more on food, particularly food as medicine. So with that, I'll turn it over to our team.
We know that a lot of our patients are experiencing food insecurity, and that impacts their ability to manage their diet-related chronic health conditions like diabetes and hypertension. And so the Food as Medicine Clinic was started to try to improve their access to healthy food and give them the education and skills needed to better manage those chronic illnesses.
Everything was high. My blood pressure, my A1C, everything was sky high. I recently had heart failure, so health was a serious issue for me.
Well, I'm diabetic, and this wasn't learned until I was in my 60s. And because I'm diabetic, I really do believe that I am what I have eaten.
Anytime you eat a food item that has some protein, it's gonna allow your sanity or your fullness to last a little bit longer. But if you combine it with
participants in Food as Medicine are receiving medically tailored groceries. We're walking them through choosing foods from each food group.
We really focus on fresh foods and foods that are low in sugar and low in sodium. One of the things that really differentiates us from other pantries is our ability to consistently offer fresh choices in all of the different food groups.
My doctor had recommended Food as Medicine, and I need to learn how to eat more healthier. And I asked them if they had any cooking classes and stuff, and she told me that they did. I said, "Oh, sign me up."
We've been able to add a cooking class thanks to the Viasana Kitchen and the support of the Greater Cleveland Food Bank. It's a chance for our participants to learn cooking skills and also get to try out some foods that maybe are less familiar to them and some healthy recipes. And then they get to take home food to prepare that recipe for their family at home.
Some of the vegetables, I was like, I never tried them. So in my mind, I said I didn't like it. But then, they were giving me like the kale. I'm like, I don't need no kale, so then I thought they gave me a recipe for kale chips. So now I'm eating kale chips.
Since I've been in the program, I've finished a lot of the other, like my heart, I don't have to see them as much. My kidneys, like everything is just positive. Without this program, I literally might not be here today. So it's life-saving.
Anyone have any questions or comments? First of all, obviously very encouraging. And as I said, a lot of the challenges in medicine today is providing for the things that we don't have direct control over, but have as much more to do with the health of the patient. So it's obviously a very important program for what we do. And here's nothing new. We will now move on to the committee reports, and we'll start with the executive committee. The committee met what's the date on April 8th. And most of that meeting was, to the point, was an executive session. And we talked about the evaluation of some of our senior personnel, including the CEO. And I think we had a very good discussion. And evaluations, CEO evaluation has been presented, and the board liaison evaluation is in progress. So that will be forthcoming shortly. Any questions about that? Hearing none, we'll move on to population and community health. Ms. Mendez.
We also met on April 8th, the Population and Community Health Committee. And at that committee, first thing we did was remind everyone of the 4 pillars that we're working on in terms of all of the lens that we're taking in working on evaluating, measuring population's health work. And that is quality and performance, barriers to health, community engagement, and patient-centered workforce. We then introduced the 4 areas that we'll be focusing on and really putting in a lot of efforts to move the needle, change, and actually measure. And those are diabetes management, we just heard about, controlling blood pressure, substance abuse, especially following ED visit, and preterm birth. And then to show how this would all work together, we took one of those focus areas, preterm birth, and looked at what metrics we would be following in those 4 pillars: quality and performance, barriers to health, community engagement, and patient-centered workforce. So that's how we're going to drive the work in population health. And I really want to congratulate the team, because this truly is a wraparound approach to each of these focus areas. Any questions? Back to our chair.
Thank you. The next committee report is from facilities and planning. At that meeting, we had an update on where we are progressing toward getting our new outpatient facility is on time for our anticipated opening. And as we heard, fingers crossed, we are still on time for meeting that. We also got updates on the various plans that are working on some of the outpatient facilities and updates on that, and started discussions on what will be the process as we have to plan for taking down some of the legacy buildings that are past their lifetime and what effect that will have on the campus. So I think most of the focus were on those areas. Any questions or comments about that? If none, we'll move on to the governance committee and Mr. Summers.
Thank you, Chairman Walker, members of the board. The Committee of Governance did meet on April 22nd. We shared information regarding potential and future education topics. However, we acknowledge we're going to hold off until our 2 new board members are with us, which hopefully will be soon. But those subjects include the revenue cycle, current and future state, federal and state reimbursement policies, funders, who, what, how, restrictions and timing. We recently became aware of some obligations to conform with the Civilian Review Board, which is a legacy of policies of our past subsidiary role of the Sheriff's Department. We will continue to get an annual update on our related entities and our continued effective use of the onboard platform. We are pleased to report that John Corlett and I were reappointed to 2 new 6-year terms, and that we anxiously await Dr. Jim Campbell and Gail Long to be appointed in May, and they would very likely join us in our June meeting. We reviewed updates and approved updates to the Human Resource and Compensation Committee Charter, which were minimal in nature, and that is part of today's consent agenda. And we also reviewed and approved for today's consent agenda Our system sole member role was Recovery Resources and approval for disassociation from Recovery Resources for reasons of dramatic shift and change of the focus and nature of service that Recovery Resources will be providing. And that concludes the report of the Governance Committee.
Are there any questions regarding that? Hearing none, thank you, Mr. Summers. And final committee report is the Finance Committee, Mr. Moss.
Thank you, Mr. Chair. The Investment Committee and Finance Committee met on Wednesday, April 22nd at 1 p.m. We first heard out from the investment advisors, Clearstead. They reported on first quarter of 2026. Cash on hand and unrestricted investments was $714 million, up from $673 million at the end of 2025. That was mainly due to the HAP. We had non-reserves of approximately $195 million. The non-reserves of where we have our investments, that was down slightly, about 3.3%. Then we had captive, which was down about 1.3% for the quarter at to $121 million. Then our reserve, which is a conservative portion, was up slightly, and that was $226 million. Then we had our CFO, Mr. Rooney, give a report on our financials for 2026 for the first quarter. We were 15 negative, which was 2.6 million better than budget and 11 million better than 2025. And the trend was extremely positive in March, where we outperformed the budget. Revenue was off 1.9% versus the budget, but 4.8% higher than last year. Expenses were 2.3 less than budget and up 2.6 from last year. Discharges, observations, emergency room outpatient visits, all below budget and last year at this time. Assets were approximately 2.9 billion, about the same as 2025. And on our payer mix, the one thing to point out is our self-pay continues to increase. In 2024, it was 5.8. Last year it was 6.6. Now it's 7%. A lot of that self-pay ends up in charity care. Cash on hand was 126 days versus 119 days in 2025. So we're back to where we were in 2024. We then had a report out on the capital budget summary, and basically we're quarter of the way through the year, and we spent 25% of the budget. We then went to executive session and heard from Kaufman Hall. In conclusion, due to HAP dollars coming in our cash on hand is back to where it was in 2024 levels. Revenue was down to lack of business, but helped that expenses were below budget. The canoe dollars were not represented, but we possibly affected the income and balance statement for the next quarter. Any questions? Mr. Chair.
Thank you. Hearing none. We'll now go on to the consent agenda. You'll see there are 4 items, all of which were approved in these committees as we mentioned above. Could I have a motion to approve?
So moved. Second.
All those in favor say aye.
Aye.
Any opposed? Any abstentions? They are approved. Thank you very much. We will now move on to our President and CEO report. Dr. Alexander.
Of course, you waited for me to take a chip. So I do want to extend a welcome to those members of our Federally Qualified Health Center Board who are joining us. It's really good to have you with us. I'll give some brief updates because a full report obviously is available on board, but just to highlight a few things, especially around caregiver safety. The workforce, the healthcare workforce is about 10% of all of the workforce, but experience 48% of workplace violence. So that truly is an incredible mismatch, and there's lots of reasons for that. We've been very proactive in this space, developing committees to take a look at this and really to think about how do we prevent violence before it happens, how do we intervene when patients or family members or others are starting to escalate so that we really decrease that. And we have had report outs from our chief around how we're increasing our police workforce presence in many of the areas that are most prone to have these things happen. In addition to that, the city of Cleveland, specifically the city council, has been looking at an ordinance, and you may have seen that we provided comment around that. For us, we have to respond to Ohio Revised Code, And so we aren't as intimately involved with what is being developed at the city, but we did lend our voice to that for the benefit of that committee and to inform what it is that they want to develop. But know that this is an area that we continue to look at and will continue to develop our proactive measures in that regard. The outpatient health center that you heard about briefly, just a reminder that in a few weeks, on May the 16th is the ribbon cutting. So we certainly would love to see all of you there. That should be a very exciting, joyful day for us, and hopefully the weather will hold out. Hoping there's no snow that day. And so would love to see all of you there. We also would love to see you at the resiliency run. You're going to hear a little bit about this in a few moments. But just to remind you that you can sign up to be on a team. We have the Fleet Feet of ELT who will be signing up again this year. It truly is a wonderful, wonderful event. So again, beautiful setting at the zoo. We're hoping for good weather, but even if the weather is bad, the good spirit and energy will be there with us. So we'd love to have you join us. We updated a little bit on the system goals that we shared with our senior leadership team. And then I'll wrap up with the City Club of Cleveland. Thank you so much to so many of you that were able to be with me on that day. I definitely felt your support and your energy. Really, I couldn't have been more grateful for how it went, and huge, huge thanks to Emily Campbell, who was fantastic to be on stage with, and to Dan Malthrop and his entire team for how wonderful, welcoming, and professional they were throughout, as well as our communications team and others and on our executive team who were so helpful in preparation. And that's it for me. I'll turn it back over to you.
Thank you. Any questions, concerns for Dr. Alexander? If none, we'll move forward and I'll have our medical staff report. Dr. Tagliaferro.
Thank you, Dr. Walker. We're close to 30 days with the opening of the OPHCs. We are actively participating in the orientation for the faculty, APPs, and the resident staff. The medical staff will be electing a new president-elect. We are accepting nominations until May 1st. The election will happen after May 30th. Our next medical staff meeting is Tuesday, May 26th. That's the day after Memorial Day, for those keeping score. And I invite any of the board of trustees to attend that meeting. It's virtual. If you need an invite, we can make that happen for you. I want to share our most recent peer review numbers with the board. Every month, our peer review committee meets, and we basically review all the mortalities in the hospital for that prior month. And we had 59 mortalities. 5 of those were sent to peer review. We also had other peer review cases that were submitted to the committee. Basically, of the 10 that we reviewed, care was appropriate in some. There were minor improvements, and there were major improvements with others. And just so the board understands, when there are major and minor improvements, a letter gets sent to the provider and meets with their chairperson and come up with a plan. But I just wanted to review those with you. Also, ODH reviewed a peer-reviewed case and found our process was appropriate and reinforcing the strength of our current peer review framework. So I wanted to share that with the board. Since we are at the end of the quote-unquote academic year, we are concluding our 2024 and 2026 Emerging Leaders cohort. We're very excited about this. We have 12 Metro Health providers that are in this cohort, and we will be seeking out a new class for the 2026-2028 group, which will start in the fall. And that concludes my report, my medical staff report. I kindly ask for a motion to approve the minutes from the MEC meeting on Friday, April 10th, and the Credentials Committee on Tuesday, March 24th.
Second. All in favor, say aye. Aye. Any opposed? Any abstentions? Thank you, Dr. Tagliaferro. Anyone have any questions for Dr. Tagliaferro? Thank you. All right, we have a couple of informational items. I think we have some related to the residency run. We just mentioned some regarding the trauma center. So Christina Nickel and Andrew Needing from the trauma department should be here to discuss. So come to the forefront here.
For us. They will click, just say next slide.
Just say next, okay. All right, thank you so much for having us back again this year. My name is Christina Nickel. I have been here with the health system for 16 years in trauma the entire time. I'm currently our Director of Acute Care Surgery Programs. I help oversee trauma, burn, emergency general surgery, and surgical critical care.
My name is Andrew Needing. I'm the burn program manager. After high school, I went to the US Navy. I did some time as a naval firefighter and rescue swimmer. Come from a long line of family firefighters. My dad, brother, cousin, uncle, grandpa. A lot of my closest friends are firefighters. So really made that connection between our first responders and the burn care center. Been with Metro for about 11 years now. And as I moved into a coordinator role, Tina asked me to be co-chair of the event about 5 years ago. Couldn't be happier to be part of this event. Celebrates our burn and trauma survivors that come to Metro Health.
Next slide, please.
So as mentioned, this will be our 10th annual Metro Health Resiliency Run. We will be back at the Cleveland Metro Park Zoo. Perfect venue for the event, plenty of parking, great for families to come out. There is a 5K run and a 1 mile walk available.
And also a kids dash if you bring your children with you as well. Next slide, please. Just a little bit of history about the run. So a little over 10 years ago, myself, Mary Barnes, who still works for nursing, and April Largent, who's the nurse manager on our trauma floor, got together and had this crazy idea that I can't believe we pulled together to have a 5K run to honor our trauma and our burn patients. And we were able to launch the first event in 2017. It was pretty small. It was right here on campus in front of the towers. There was just like a small committee and about 130 people. And it was so exciting and amazing, and we couldn't wait to continue. And it grew bigger and bigger every year. We had to take a few years break during COVID and do a virtual event. But we kind of exceeded our space here on main campus with all of our transformation. And in 2022, we transitioned to our partner at the Cleveland Metro Park Zoo, and we've held it there ever since. Go ahead, next slide.
So our mission is really to showcase an event that showcases the strength and resiliency of our trauma and burn survivors, as well as celebrating all the caregivers that come in contact with our trauma and burn patients from time of injury through discharge and beyond. So that's our first responders, our nurses and doctors that work in the emergency department, our ICU nurses, our trauma floor nurses, as well as our professionals at the rehab center.
Okay, go ahead, next slide, please.
And these are just some photos from last year's event.
So you can see very family friendly. My daughter and my nieces are there in those pictures as well. And Dr. Alexander with one of our strong survivors. Next photo, please. Or next slide.
And this slide is just kind of highlight the growth of the event year to year. Last year, we had almost 1,200 participants between the 5K, the 1 mile, and the kids dash. This year, we anticipate close to 1,500 participants as the event continues to grow and grow.
Next slide. If you have not been able to join us in the past, we really wanted to give you just a brief picture of what the essence of the day is like. Dr. Alexander had a great explanation, but it really is, you have to be there to feel it. And so hopefully you can all join us this year, but if you guys want to go ahead and play the video. I don't think our sound is working. Is it on your screen? No, there's nothing on this screen.
Sorry, hang on one second.
Oh,
Okay, thank you, Brian.
Sorry, it's too good of a video to skip. Give us a second.
It's not the first time we've had a challenge. Won't be the last time.
I joked yesterday we couldn't get the.
Yeah, that's
to
the
work.
thing. That's what I was like.
It wasn't turned on.
Yeah.
Well, while we wait, we have really great swag also,
Oh, yes.
which can be ordered. So
Swag shop.
If you get to the, maybe you should maybe flip into the,
Resolution.
yep.
I can do that while they're trying to figure that out. So part of my role, in addition to being able to support amazing events like the Resiliency Run, is I help oversee our verification processes for trauma and burn. So we're verified for trauma by the American College of Surgeons as a level 1 adult, level 2 peds center, and by the American Burn Association as a peds and adult burn center. We have to be re-verified every 3 years, and we are looking for the support from the board. You should have the resolution in your board packets. If you guys have any questions, I'm here to answer them, but looking for your support to move forward with that resolution for both verification visits. Any questions?
Oh, no, Brian, I don't know.
I'm terribly sorry. I'm not sure why we're not getting audio.
We can maybe send the video out to folks.
Yes, we can send the video out.
Yes, or yeah, we'll just keep coming
Come back
back until
again.
it works. You can go ahead and go to the next slide then, and we can figure out the video part. Oh. There we go. Okay. I think if you would have seen the video, you would have been like, wow, this is great. How can I get involved? You might still be thinking, so yes. So if you're interested in participating, we have many ways you can get involved. You can actually participate in the actual event, bring your friends, your family, your children, whoever you would like, create a team. The QR code there is to actually register right on the Run sign up form. There's teams in there already created, but if you want to create a new team, you can. We also are always looking for volunteers for the event. So if you're interested in volunteering, please get a hold of Andrew or myself. We take volunteers for the days leading up to with prepping the race bags, giving them away, registration, things like that, and also the day of, people on the course and kind of behind the scenes. We also are always looking for people to help us promote the event on their socials and within their network. So you might see it on Facebook, Instagram, LinkedIn. The board, the Mental Health Foundation board is very supportive and shares it often as well. And you also may be interested in becoming a sponsor, or you know someone who would be interested in sponsoring an event like this. So if so, please connect with us. We can connect you with Kate and her team, who are a great partner for us in this event. And they've helped us increase our sponsorship exponentially over the last few years. So any questions?
Thank you very much. Like I said, we will get back to you. Either or both included in the list that we sent out, or we may have to come back and test that. But thank you very much. And we apologize for the technical difficulties there. All right, we have one more informational item, and that is regarding the Mental Health Center for Community Health Centers. Excuse me, that name, I get it backwards all the time. I'd like to ask Kate Nagel to come forward to talk about this. And I'll just lead off by saying, one of the things, at least in my opinion, that makes Metro very special is its commitments to the communities that it serves in its community health centers. At various times, I had the privilege of leading some of those centers, and they have evolved even way beyond when I was there. So I will turn it over to Dr. Nagel, and she will explain what's happening in our Metro Health Community Health Centers.
Thank you. And I think I'd first like to start by, we have the Metro Health Community Health Centers Board of Directors here, both in the room and on the screen, and our key management team. And if you wouldn't mind standing, please. And so that we can just say a little bit about, I do try to make it a point not to follow things like pharmacy robots and the resiliency run, because I get to talk about things like a federal designation, and that's just so great. But these are really the people that are the FQHC. What really separates an FQHC from another, community health center, nonprofit, et cetera, are the board of directors. It is a patient-led board. And so the folks that you see standing around here are not just patients of the Metro Health System, they're patients of our community health centers. They go to the Glenville Health Center, they go to the Broadway Dental Practice. These are our folks that receive their care from us and then in turn spend a lot of time with us every month, just like all of you, overseeing the governance and providing governance and overseeing the strategy and the operations, the financials of the community health center. And it looks solely at those the services and sites that comprise that group. So we can't really highlight those who are on the screen, but we do have some folks that are on the screen as well. And Linda Ryan Allen is a resident of Glenville, a longtime patient of the Glenville Health Center, and is the chair of our board. And we have the majority of everyone is a patient of Metro Health. The majority are patients of a community health center like Glenville, or they serve in a capacity as an expert like Dr. Walker, who is our shared patient between the system board and the FQHC board. And then some of you may recognize, if you saw him up on the screen, Dr. Ron Fountain, who is also a longtime friend of Metro Health System, is a member of the FQHC board as well. So I thank you to having us come, and we'll just give you a quick update. It's been a while since we've been here. And so if you'll go to the next slide, please. So this is just a snapshot of the communities that we serve. So the stats that you see here on this slide are Glenville. And we talk about this a lot. We talk about this on the system side. We spend a lot of time talking about this on the FQHC side. But when you get into why did we do this? Why did we say the system from a mission perspective was very much aligned with the tenets of the health center program? Why would we go a step further and actually, while it is great to be able to have patients stand up and say, thank you for letting us oversee what you do, why did we think that that was what a way in which the system should move forward? And this is a lot of why. It's why we talk about the social drivers of health. It's when we talk about what it is that our patients and our community members face day in and day out, and in recognizing the importance that we are more than just medical care. And not only do we see that in the way that we provide care, but now we also see it and live it through the way that we govern some of our activities. Next slide, please. So there are a number of ways that you can address those statistics on the previous slide. And one way in which you see across the country is through the HRSA Health Center program. This is a program within the federal government under the tenets of the Health Resources and Services Administration. It grew out of the social justice movement of the 60s. It's been around since then. It was the recognition that you really couldn't be all things to all people, and there needed to be a partnership approach, but there also needed to be federal commitment, federal dollars that went into the local community in an effort to try and address what people were seeing in their communities. And so the Health Center program is a national, it is a movement, and it is a best practice. And so it's constantly evolving as well across those tenets that you see along the bottom of the slide. And also on the x-axis and the y-axis of what they do in order to provide best practices and a community health program model that could then be replicated in local communities. And so there are tenets in which they dictate that an organization that's going to be called a federally qualified health center needs to adhere to. When we took a look at this, back in 2017, back in 2018, and I think long before then as well, of looking at why can't we do this? A number of hospital systems or safety net organizations will say, we do all of the same things. And so why wouldn't we go ahead and do this? And when you dig into each of these tenets, it looks a lot like Joint Commission, and it looks a lot like the conditions of participation. It's just a lot of information and a lot of governance that you have to follow. And so if you'll go to the next slide, please. So we decided we would give this a try. So this is our very simplified timeline. I came on board in 2018. For a very long time, this was all I did. I was the FQHC girl. I came from an FQHC. I had been with the health system prior to that. And so one of the reasons why I came here was because I knew that we could put those two programs together. As a public entity, Metro Health has the ability to have a federally qualified health center. You partner with a board of directors that follows all of the tenets that the federal government sets for those board of directors, which is why the system has a board and the FQHC has a board. And we're treated to a certain degree as one of our related entities. So we're the same, but we're different. And we spend a lot of time working on that. And that's why you see that there was a lot of launching and then a couple of years while we tested and how we've scaled and then stabilized over the last couple of years. We started in Glenville with a 3,000 patient, very small, very important community clinic to say, can we do this? We started there in 2018. We then added the school health program. We added the Broadway dental practice. We added our community mobile clinic and our homeless service patients as we moved through that testing phase where we had it figured out to a degree of like, okay, we can do this. We know how we're going to partner with the system. We know how we're going to partner amongst one another. We know how we're going to do this day in and day out, where people feel at the very front line, both from a patient perspective and from our provider perspective, like this is just an inside baseball thing. We really are all one big family, but we're able to continue on the FQHC side to adhere to those tenets that I mentioned because they are very real. In 2024, we added some of our larger community health centers. We added Buckeye, Bedford, and Brooklyn. And what that brought us to in 2025 is we now have over 40,000 patients in the FQHC footprint. And I think the last time I was here was like 2023 maybe. And so we were probably around like 10,000 patients then. So over the course of the last couple of years, we really have grown, and we've grown to include a large chunk of what our primary care base looks like. If you'll go to the next slide, please. And this is what our footprint looks like now. So we have a number of clinics that you see in the community that provide primary medical care, general dentistry, integrated behavioral health services, as well as OB-GYN and nutrition. We're very heavy in the community. This is very important to us because being in the community, boots on the ground in the community has long been a part of the Metro Health system. But this is the way in which we can connect our community programs and when we see our patients in the community, either in schools, in a homeless shelter, on the streets, in the jail, and how we then try to bring them when they're ready into a more traditional form of care in one of our clinics that are located strategically across the county. And then keep them for specialty services so they can stay within the system, never knowing the difference. You're a Metro Health patient regardless of where you see us and regardless of that, if that's under the FQHC model or if that's under the system. So you see on the right-hand side, all the places where we have access points. Important to note, and things that we are very proud of, is in the last year, a year ago, we opened our own retail pharmacy at Brooklyn. We built it, we opened it. It was very exciting for us. Pharmacy, I think we talk about it on the system side, how important pharmacy is, but also how under attack pharmacy is all the time. It's no different at the FQHC. And it is such an important service that we provide to our patients. To be able to have that on site has been huge. We also partner very closely with all of our programming through the Institute for Hope. We have our Buckeye Clinic, which has the Opportunity Center right in the same place. So we're able to make sure that we have that embedded wraparound program. And as I mentioned, we have a dental practice, which is huge because there is very little access across the community, especially for those who are underinsured or uninsured to seek dental care. And we're able to really do that. We also have a residency program that is specific to our dental practice, where we're training the next generation of dentists that are interested in training and learning how to provide care in an underserved area. Next slide, please. And this is my favorite slide. This is all of our quality badges. So the federal government, when you are an FQHC, you are required to submit an annual report that encompasses everything. Truly everything. So it's straight volume, it's quality, it's financials, it's your staffing model, it is everything, and it is a beast. And I usually like to kick it to Dr. Golub to say something about this, because this is when he says how amazing the FQHC is. Please take
Yeah,
it.
so I absolutely look at all of their quality metrics and absolutely knocking out of the park. Beating some of our other local clinics.
6 of 8 system goals.
Yeah, 6 of 8
ahead.
system goals ahead of our, so are really driving our system goals with these patients. And again, those system goals are really stemmed around what we heard earlier: diabetes care, blood pressure care, cancer screenings, all of those excellent population health metrics. This patient population is getting top-notch care throughout the organization.
So these are badges that, again, we are weighed against every other FQHC across the nation. And the gold badge that you see on the lower left-hand side says that we are a health center quality leader, which means that we are in the top 10% of all FQHCs across the nation. And I want to make the distinction that we are a lookalike. And that means that we do not receive any operating dollars from HRSA in order to support any of the work that we do. The primary difference between a full-fledged and a lookalike is that you do not get annual operating funds. And that's huge. And so we are often asked to attend if they're like, how are you guys doing this? And so we've spent a lot of time working with Dr. Golub, working with Matt Kaufman, working with other folks across the system to make sure that the work that we're doing in the FQ not only adheres to what we need to do for HRSA, but it also is right in line, as Dr. Golub just said, with what our system goals are. So we're not doing anything different, and we're able to make sure that it's additive, but it also is allowing us to separate ourselves from everyone else, not only in Cleveland, not only in Ohio, but across the country. And we're very, very, very proud of this.
And truly setting the curve. They are the bear that everybody's chasing when you look at these metrics. So no question about it. It's not even a fair comparison. So.
I'm going to end on that. I don't have a robot, but I got Dr. Golub. Oh, I had one more slide. Shoot. So this, I guess I'm not ending on that. So this is, we started using this framework over the last couple of years. And as we shift into 2026 and just closed out our first quarter and gave that report to our board of how we were performing following the first quarter, our word is to optimize. You know, as you saw what the words were as we traveled through those steps of our timeline. And now we spent the last year stabilizing, really making sure that everyone understood what the tenets were, what our structure was, what that meant. A lot of that was about infrastructure and building the infrastructure, and that allowed us to scale. And this is now focusing on how we optimize. And so these are, again, the categorical tenets of the federal government of the way in which we're measured by HRSA, and then how we live them out really in all of the work that we do. So we're excited to we just spent the last hour and a half walking through the launch of our strategic plan and what that means. Every time we do something, we try to have that be aligned with the system. So again, we're same, but we're different, but we're connected and we're a partner. And we thank you for the partnership that we've had and for the time that we had today to bring our board members in and just share a little bit more about who we are. So that, I think, was my last slide. Yes. All right.
Well, any of our MHC board members like to say anything? Any anything you want to add? Don't look shocked. Don't feel obligated, but just give you an opportunity. Any questions from the Main Center board? It's a lot of fun to serve on 2 boards at the same time, and we're both t-shirts because we've agreed that I'm not wearing hats, but I do wear 2 t-shirts. So they do great work, and it's a privilege for me to serve on that board. So thank you, and we will always stay in touch. So, all right. So I think we're now ready to move into executive session. I will ask the public to step out. We will move into executive session to discuss hospital trade secrets as defined by ORC 1333.61 to consider the appointment, employment, dismissal, discipline, promotion, demotion, or compensation of a public employee or the investigation of charges or complaints against a public official and to conference with the public body's attorney to discuss disputes involving the public body that are subject to pending or imminent court action as defined by ORC 121.22G. Do I have a motion?
Move.
Second? Second. Thank you. We will now do the roll call. Mr. Arnold?
Yes.
Mr. Corlett?
Yes.
Mr. Ron D?
Yes.
Okay, Dr. Walker. You are now back in public session.
Yeah. So I'd like to thank everyone. We had some very thorough discussions on a multitude of topics regarding to the system, and I think it was quite a bit of learning done. Seeing that, we also now have some items that have come forward for approval by the board. And I would like to first ask for a motion to approve the reaffirmation of commitment to maintenance of a level 1 adult and level 2 pediatric trauma center at Metro Health Medical Center. We have a motion.
So moved.
Second. All in favor? Aye. Any opposed? Any opposed? Any abstentions? Motion carries. Now I'd like to ask for a motion to approve the reaffirmation of the commitment to maintain a verified adult and pediatric burn center at Metro Health Medical Center. Do I have a motion?
Motion. Second.
All in favor? Aye.
Aye.
Any opposed? Any abstentions? Okay. So approved. Third, I'd like to ask for a motion to approve of naming of facilities and recognition of contributions made for the benefit of the Metro Health system. Do I have a motion?
So moved.
Second.
Second, thank you. All in favor? Aye. Any opposed? Any opposed? Any abstentions? Thank you. And finally, I think we have, that's it, isn't it? Is that all? That's all?
Oh.
All right. 4:58. We are adjourned. Thank you.
Thank you.
Despite the 1 hour CEO report.
That's all right. All important stuff.
It was.
Thanks for doing that, Rob.